Hi everyone. In this short video, I will be talking about the difference between two very popular CT scans in cardiology, coronary calcium scoring versus CT coronary angiogram. There seems to be considerable confusion about the utility of these two CT scans, even amongst health professionals, and I will try to clarify these differences. So let's start. It is important to note that both of these tests, coronary calcium scoring and CT coronary angiogram, are using the same machine, which is a CT scanner. But despite the similarity, the way they are carried out and their individual objectives differ significantly. The most important difference is that in CT coronary angiogram, we use contrast material which is injected through forearm. However, in coronary artery calcium scoring, there is no injection and no contrast is used, and we are just using a plain CT scan. Now let's look at some of the other differences between the CIC and CTCA. So we did mention that CIC does not have contrast, and in CTCA we use contrast material. CIC, being less involved, uses less radiation compared to CT coronary angiogram, which is more involved and gives us more detailed pictures. Coronary calcium score can only show us the presence or absence of calcium in the coronary arteries. However, CTCA can show us blockages within the arteries. Coronary calcium scoring is done only in people who have no symptoms. In contrast, CTCA is done in people who have certain complaints like chest pain or shortness of breath on exertion. CIC is done to assess someone's future risk of a heart attack. However, CTCA is done to find the cause of someone's complaints. And last but not least, CAC or calcium scoring is done in people, only in people who are low to intermediate risk from cardiovascular disease point of view. But CT coronary angiogram can be done in anyone with any degree of risk. Here we have a few examples of CT scans in coronary calcium scoring and CTCA. The striking difference between the pictures is the brightness that we see in the CTCA images. Here in aorta and left atrium, we can see this brightness, which is due to the presence of the contrast material, which creates this distinctive contrast between white and gray. However, if we look at the coronary calcium scoring, we can only see a silhouette of the coronary artery. So here we have the coronary artery that we can just see a shadow of it, while here we can clearly see the coronary artery with the contrast material inside it, so we can say this artery is not blocked. So the question pops up that if we can't see the arteries clearly, then how a CACS score can help us? I will try to answer this question by these two images from two different patients. On the left, we see a perfect calcium score CT with absolutely no calcium in the coronary arteries, so the score is 0 here. And on the right, we see that this person has got significant amount of calcium present in the coronary arteries. Here the calcium score of this person was actually 800, which is severely elevated. By looking at these pictures, we can only, remember, we can only say that this person is at higher risk of heart attack in future compared to this person. We cannot judge or say whether there is any blockage present under this calcium, because that is not the purpose of doing a coronary calcium scoring. And that's why these tests needs to be done in people who have no symptoms. We only do this test to assess someone's future risk of a heart attack. Here we have a few more examples of CTCA versus calcium score. On the sides, we have two images of CTCA. If you look at the left image, you can see a clear and nice artery with absolutely no blockages. The reason we can see the artery quite clearly is the presence of contrast material inside the artery and the aorta, which creates this beautiful differentiation between the artery and the surrounding tissues. In this CT coronary angiogram, if we look at this area of the artery, we can see there is a severe blockage. This blockage is the cause of the chest pain. This person has presented with chest pain, and that's why this CT coronary angiogram was done. So remember, CT coronary angiogram is done to investigate the cause of the complaints, including chest pain. However, coronary calcium scoring is done in people who have no complaints. They have no complaints, and we are only looking for the presence or absence of calcium in the coronary arteries. As you can see here, we only see a shadow of the arteries, and we are not able to say whether there is blockage or not. It is only to assess someone's risk for future heart attack. To summarize, both coronary calcium scoring and CT coronary angiogram use CT scanner machine. Coronary calcium scoring does not use contrast, while we use contrast in CT coronary angiogram. Coronary calcium scoring has less radiation compared to CT coronary angiogram. In CAC score or calcium scoring, we only look for the presence or absence of calcium, while in CT coronary angiogram, we are looking for the blockages. In coronary artery calcium scoring, the person should not have any symptoms, no complaints, while CT coronary angiogram is done in people who have a complaint like chest pain or shortness of breath with exertion. Coronary calcium scoring is only to assess someone's future risk of a heart attack, while CT coronary angiogram is done to find the cause of the symptoms. Coronary calcium scoring is done only in people with low to intermediate risk of a heart attack. It means that if their calcium score is very high, the person with low risk will move to high risk category. For example, if you're someone with hypertension, high cholesterol, diabetes, and a strong family history of a heart attack, you are already in high risk category and you do not require a calcium score. All you need is treatment of the risk factors. I hope the video has been useful, and please don't forget to subscribe to be notified about the future videos. Thank you.